A nice example is 5 cases that came out of this larger study at the National Cancer Institute in Milan. And for example, there was one case, this was actually a friend of the chief oncologist who had stage 4 lung cancer. It was just doing immunotherapy and it wasn't working. Then they added the fasting-mimicking diet, which comes in a box. So they did immunotherapy plus the fasting-mimicking diet. And this patient went into remission. And then they published a paper. So we adapt the everyday longevity diet, the fasting-mimicking diet, and also ketogenic diet. That's something else that we use, particularly with certain cancers, like glioma, very aggressive brain cancers. For that, we also use the ketogenic diet, and we rotate all these different diets to just make it very difficult for the cancer to adapt, of course, in combination with the standard of care. And this has been working very well for many, many cancers. Of course, we have to wait and see what all the clinical trials show. But the initial clinical trials are very positive. For example, for triple-negative breast cancer, metastatic, so women that have this very aggressive breast cancer, which has gone everywhere in the body. The Vernieri group in Milan has just published that the 4-year survival rate almost doubled if they were doing the fasting-mimicking diet plus chemotherapy versus chemotherapy alone.